This video is going to include a review of what a SOAP note is. This recording is going to come from the SOAP review PowerPoint that you can find on Canvas. So to start off, what are SOAP notes? SOAP notes are simply a way that we can use to document evaluations and progress notes for patients. So SOAP notes are concise format of effectively documenting initial evaluations and progress notes. Inside of a SOAP note, there's several sections, and they record subjective and objective sections as well as assessments and plans. So that's why we call it a SOAP note. Subjective, objective, assessment, and plan. SOAP notes are useful because they are used across various healthcare professionals, and they create a concise way for you to be able to communicate effectively across healthcare professionals about what is going on with a patient. So as notes are transferred, it makes it systematic so that you don't have to work too hard if you dive into someone's care halfway through. So just a quick overview of the sections. S, I've already stated this, S is the subjective section. Inside of this section, you are going to include information about subjective statements provided by the patient. So these are things that you cannot necessarily measure, but they are still important for your note. So for example, what happened, or describe the pain, or rate your pain on a scale of 1 to 10. These aren't things that you can necessarily inherently measure, but they're probably things that are pretty important for you to record in terms of information for your evaluation. You know, a few other things. What makes it better? What makes it worse? Does the pain move? Does it radiate? Do you feel it hurt at certain times of day, et cetera, et cetera? So these are all things that the patient tells you that are important, but you can't objectively measure. Okay, so in short, the subjective section comprises the history taken during an evaluation. So these are some of the questions that you might ask that would relate to the S section of a SOAP note. How did this injury occur? Where do you feel pain, et cetera, as you go down. The next section of a SOAP note is the objective section. So these are things that the clinician can gather objectively during an evaluation. So these are things that the clinician sees, that they hear, that they feel, things that we gather through our senses. So these findings could include things that are inspected, things that are palpated, or any type of range of motion assessment, any type of observation we make about posture or functional movements, if there's swelling, discoloration, deformity, bruising, scarring, etc., things that we can see objectively and notice, those things are going to go inside of the objective section. So I tried to summarize this here. So HOPS is another acronym that we might use that go inside of a SOAP note. So HOPS stands for history, observations, palpations, and special tests. One more time. HOPS stands for history, observations, palpations, and special tests. So HOPS is a systematic way to perform an evaluation. The H portion of HOPS goes in the history. The observations, palpations, and special tests, including range of motion and including imaging, go in the objective section. This is going to lead you to an assessment. Okay, this will lead you to an assessment. So what you think is going on, the clinician's professional opinion about the nature of the injury. So examples of this are going to be grade 2, right? Lateral ankle sprain. Grade 2, lateral head of the gastrocnemius tear, etc. Right subacromial bursitis, whatever it might be. That is the A. So we do the S and the O to get us to the A. And then finally, this class, the P is outside of the scope of this class. I will not ask you to do this inside this class. But the P is, well, what are you going to do about it? So just to finish this idea, it's the plan. So your patient has a lateral ankle sprain. Well, what are you going to do about it? Is there any first aid? Are you doing any future treatment? Are you referring them to the doctor? Are you doing ice, heat, etc.? Okay, so the P also includes doctor referrals, short-term girls, long-term girls, and when the patient will return. So this was specific for athletes, but when the patient will return for treatment. Okay, so that I want to just show you guys. So once a SOAP note is completed, it's going to kind of look like this. So this is an example of a SOAP note that I keep on my computer. So here in the S section, we're going to see essentially the history. 26-year-old male soccer player complains of left ankle pain. Reports colliding with another player while playing soccer 2 years ago. No past medical history of injury to either ankle. Athlete reports a loud crack. I mean, I think you guys see this. These are all part of the history that was obtained on this individual. The O is going to include observations, palpations, and any special tests. So mild swelling, that's an observation. No visual deformity, discoloration, atrophy, bleeding, spasm, scarring. So I don't see those things. I observe those. But there was some deformity noted with palpation of the anterior talofibular ligament, but it's not tender to palpation. Athlete is tender to palpation over the posterior talofibular ligament. Et cetera, et cetera. So you see the observations that I was making. Notice here as we move down, I did the palpations, and then I move into special tests. Range of motion, I did a special test, and then I did sensation. So this led me to an assessment and a plan. So for your guys' SOAP notes that you will do on your evaluations, I expect you guys to have an S, an O, and an A section that looks something like this. And that finishes this video going over what I expect for your SOAP notes and what a SOAP note is.